everyone. I'm Dr. Jihan, and this is Raising Resilient Minds. And I'm so excited today to have with me a guest, Dr. Charlyce Davis, who is here in Oklahoma City with me. And she's actually an Oklahoma native and is doing amazing, amazing things in the medical field. And she happens to be a physician who also likes to think outside the box and look at different types of healing methods. And I wanted to share some of those things with you. So, Dr. Davis, if you don't mind, just give us a brief little bio of yourself.
Dr. Jihan, I'm honored to be on your show. And listeners, I know that they know you, but I am continually impressed with you as a physician, as a woman, as a mother, and a wife. And I don't believe you brag on yourself enough. Okay, now I'll go
Thank
on
you.
to my
You're
stuff.
so sweet.
Listeners, I was just telling her she doesn't brag enough. So I'm usurping her podcast to brag on her and her magic. But I'm Dr. Charlyce, and I'm an internal medicine physician, and I've been practicing internal medicine for 20 years. And it's around, oh gosh, how this has been 8 or 9 years ago, through a series of lucky events, the universe introduced me to the practice of Reiki. So I initially learned Reiki just on myself and then eventually shared with others, friends, and family, leading me to a place now where I offer Reiki sessions to clients in a studio in Oklahoma City. And then I work in a couple of online spaces. So I have a website called healingartshealthandwellness.com, which is got information on Reiki as well as integrative medicine, some other topics that kind of go in between the worlds. And then Dr. Charlyce, which is just DrCharlyce. If you Google that, will take you to my website that tells you about my functional integrative medicine practice. So yeah, it's so nice to be here. I think this is amazing work you're doing, Dr. Jihan.
Likewise, and love your podcast as well. So always a pleasure to understand, what other people are going through and trying to get that information out, right? So we can best help our communities. So one of the things I love asking guests is, how do you define resiliency?
I define resilience as the ability to recover and restore from life stressors. Because stress, which can actually, it could be good stress or bad stress, is taking us out of our baseline of functioning. So we may have a certain routine that we keep or a certain way we do things in our body has a certain physiology it's going to be in every day. The way I see stress is it pulls us out of that. Maybe we did it intentionally, like with exercise, or unintentionally. A relative gets sick and we've got to go stay in the hospital with him. But if you have resiliency, hopefully you're able to move yourself back to your baseline where you operate the best.
Yeah, I like that. I like that. I like the word restore, right? Restoring kind of what
Restore.
was there, that baseline. And I think that the key with that is, of course, the foundation, right? And so that's one of the things that we try to educate people on with this podcast is, how do we build that foundation? And then also, for some who may not have that foundation as a child, even as adults, what can we do to build that foundation again? Because sometimes life's happenstances, we're not able to build a great foundation of resiliency. And so as adults, sometimes we have to work on those things as well. So as an internal medicine doc, right, I know you see tons of patients, tons of pathology and things like that. But are there any particular things that you may see that you're like, man, if people had been able to learn more about resiliency, they probably could have prevented some of these things?
So a few years ago, I can't remember what made me do the research. For some reason, I had to research childhood experiences, topic that y'all know you'll know front and back, the adverse childhood experiences score. So where we're different, of course, is my population, the population I'm going to work with is always adults and typically veers towards older adults, so adults over 45 or 50. But once I start reading about ACEs or adverse childhood experiences, I know for you being a well-experienced pediatrician, this is not shocking, but it rocked my world when I found out these adverse childhood experiences increases your chances of having autoimmune diseases, increases your chances of having cancer, increases your chances of having heart disease. And as I went down that rabbit hole, because for in internal medicine, in a way, we're not permitted to think about a patient's childhood. But as I, whatever took me down that path and realizing that, and I started to question my patients, what happened in your childhood, particularly patients who had chronic illnesses that were not seeing improvement despite multiple specialist medications and radiation and all of that. And sure enough, if it did not ring true, that as they would start to share something that happened in their childhood, and I wouldn't have to prompt, a lot of patients would actually make the link exactly themselves, that they can recall something happening in their childhood affecting a part of their body, and that's what they're experiencing as an adult. It was like, I know Dr. Jihan knows this, but it still shocks me to this day, that link between, the childhood experiences, which it turns out we can't avoid, that all of us are going to experience it because we're on the planet, we're on Earth, and we're humans, so we can't avoid it. But if we can understand that, oh, you were saying baseline, we can understand what our healthy baseline may be. So once I learned about adverse childhood experiences, it helped me to understand that for many of my patients, their healthy baseline, we don't know, because it may have been so disrupted at the age of 2 or at the age of 6 or at the age of 14. And these are at the same times that, significant developments happening in their body. So as I'm meeting them as an adult, I'm meeting this adult whose baseline is to have this, the adrenal glands that are constantly overworking and overproducing stress hormones, having a nervous system that stays on alert and looking for a threat constantly. So the person I'm meeting 60 years later has lived in this for who knows
For
how many
so
decades.
long.
So long. And internal medicine, although it does help me to understand the disease part and pulling apart and diagnosing the disease, it's with the practice of Reiki that I could understand that time part, and that if we're going to make any progress, we may have to time travel, do a little quantum stuff where we're going to have to bend time. And it's a weird concept. You can get there if you're not used to it, but it is possible to think about how, if you're living with something, to really get to the root of it, you may have to bend a little time to fix it.
No, and I want to touch on that in a second. One thing I wanted to, mention is with the adverse childhood experiences is, as you said, like, we can't necessarily change it, right? Parents got divorced. Somebody went to jail. Some of these things, some families just cannot change. Mm-hmm. However, we do have so many statistics showing that if you create these resiliency factors on the other side, so say, for example, programs who work with children whose parents are going through divorce, right? Mm-hmm. Us coming and helping families who the parents are arguing and not getting along or have substance abuse. We're providing more programs to help these families, right? Mm-hmm. Providing resources, therapy, or counseling for these children, or just supportive adults in their lives, mentorship, being able to see people who look like them or people who have shared experiences with them, who can reassure them that they will make it through. So that's building some of that resiliency. And so I always, sometimes people see the ACEs scores and they're like, I'm doomed. I'm like, no, you're not doomed. We have to figure out what are the resiliency things that we can set up next to the side for you, protective factors, which are going to build this resiliency. And kids in those environments, they thrive despite their challenges. And we often see on TV people say, oh, I came up from this and I survived this, and I should be a statistic. But we have to start actually looking to see, why aren't you a statistic? Mm-hmm. What were the protective factors that came into your life that helped you become who you are today, instead of just saying, I made it out? Mm-hmm. When you go back and look, there's almost always somebody or something that changed that person's trajectory.
I love that.
And we have to realize that the role that we play, I'm saying as physicians, but just as human beings, like we all have a neighbor or we all see somebody who may be struggling, or we may hear about something, right? Unless you just completely live in a silo or a bubble. We have to start asking ourselves can we be that protective factor? Can I send over a meal, to that new mom who's super stressed so that her 4-year-old doesn't see all the stress?
Mm-hmm.
You know what I'm saying? Like
Oh, I love
itty bitty
that.
things that I think that we don't think about sometimes because just the way our society is, we're kind of a pretty egotistical society. It's all about me. It's not about anyone else. But
Uh-huh.
what we don't realize is that we too thrive off of that. Somebody calls you and say, "How you doing today?" You're like, "Oh,
Mhm.
somebody thought of me."
I'm
I'm
special.
sad and down. It's like those are things that are protective factors, right? Just having a community of people who think about you, who care about you, that you're not alone in this world, in this space, fighting a battle. Why? Why you got to fight these battles? See how you can find things or people that can help you with that. So I always like to just add that part. I did a
Mhm.
lecture a few years ago in DC for a group about this exact topic. Like this is the doomsday aces, right? But this is how we make that change, and this is how we change that trajectory. So in terms of Reiki, because I want you to do explain a little bit more about kind of going back. And I know some of this happens in breath work and lots of different ways that people sometimes will ask you to go back to that inner child or go back to where that entity started, that pain
Yes.
or trauma, whatever it might be. So can you explain it just a little bit in layman's terms for us?
Mhm. So, Reiki is the practice of, it falls in the realm of energy medicine under the scope of holistic medicine. Reiki is the practice of channeling highly intelligent, intuitive energy from a higher source into a receiver. So, the energy that's channeled in Reiki is energy that heals, it protects. You can set an intention, but if there's a situation where there's overwhelming suffering or sickness, you don't have to set an intention because Reiki will go in and do the healing without you having to understand what's happening. The source of Reiki, it depends on the practitioner. So, Reiki is a training modality. So, you learn it from someone that already practices, like a Reiki master. And as you're going through your Reiki training, you do your own healing work, and then you also determine your higher source, who you tap into. So, the beautiful thing with Reiki is it works with a religion and without a religion. So, if you are practicing in any religion, you can use that to augment your Reiki practice. If you are an atheist, you can actually practice Reiki. You don't have to actually believe in God because that source of energy you're channeling is of a higher dimension. Once it gets into the person receiving, then Reiki does its thing, and that's where it gets a little mysterious. So that's kind of the hard part for people
The
to
woo woo,
understand, that
the woo
we
woo
just have to accept
medicine.
like it worked and the woo woo and kind of. So yeah, so we don't know really like what it does, but there's some research that's coming up where they're giving it some names and they're able to kind of quantify. So it'll be under the terms like biofield therapies or biofield energy. So, they're able to do a few quantifications, and they're starting to, rein some things in with some clinical studies to show how Reiki can benefit, many types of medical conditions and psychological conditions beyond just what someone might seek Reiki for.
Well, thank you so much. So when you have a client and you're wanting them to kind of go back, and I know you don't have to go through everything. They
Mhm.
obviously can hire you and experience it themselves.
Yeah.
But in terms of what are some of the feedback that you get or those aha moments or and kind of like what do you see come out of that?
Yeah. Well, and actually, bending time or going back, you should always feel comfortable doing that. It's actually pretty easy to do. Someone can work with me, but really on your own. Because, of course, I know you've heard of like inner child work, but
Mhm.
you simply, if you are someone that meditates on a regular basis, it's easier to wrap your head around. But however you get into a meditation, sometimes it helps if you're doing it with a journal, or if some people journal to meditate, and you can just set the intention of, I have this problem and I want to go back to when this started. And when we do this in Reiki, as humans, to do that kind of work, we have to calm the thinking mind. So meditation is one way to do it, but a lot of people do it many ways, including like psychedelics and those kind of things. But once you can calm down the thinking mind, the front of the brain, then you can just simply ask your higher self or however to take you back to the moment when you sensed or perceived something. And whatever answer you get is right. That's the key. That's, you were saying, Dr. Jihan, that, sometimes our egos get in the way, but when you start working with the past, whatever moment pops up is correct. You just have to remember that you're interpreting it as an adult. But the moment that popped up may have been the 6-year-old version of you that interpreted, the Tommy taking your toy as a major assault, because at age 6, it really was. Now, as an adult, you might laugh at it, but when you do that kind of time work, you have to put yourself back into the 6-year-old version of you of what was trauma. And then you work your ways forward as far as physically, how did I change and what is that leading me to now? It is something you can actually do on your own. You can work with me or someone like me, but it's a beautiful practice to do on your own.
I will say this summer at a retreat I was at, we did breath work with someone who's a well-known, like, I don't know the correct term, but he does lots of breath work sessions. Yeah. And it was a packed room, probably like 60 of us laying down, doing the breath work. And then he decided to do the inner child work. And you could just hear the sniffles and the cries, and the tissue was already out there because he knew what was going to happen. But it was so eye-opening for me, because I'm one of those people who most people look at my life as a life of privilege. And I acknowledge that, right? 2-parent home, dad was a doctor, mom was like we had all these things. Like we weren't struggling. I knew I had a meal, all these other things. No one went to jail. Things that people are like, oh, did you have a trauma-filled life? And I'm like, I didn't have a trauma-filled life. However, it was so interesting to do that work, to realize that we all experience some. Yeah. Even if you think you lived a privileged life. Yeah. And that trauma could be, what people have said to you, how people have treated you, even expectations placed on you, right? And so you have to forgive that inner child, right? So that you can move forward. Or say, I acknowledge your pain. I acknowledge your pain as that younger inner child.
It's very important that once you do that work, that you want to try to really not to judge, because now as an adult, you have life experience and things, and you've got a scale of, unfortunately, like a scale of suffering. But when you rewind back to that moment, you didn't have that. So at that moment in time, it really was traumatic. So yeah, you have to acknowledge, and which of course, but it's just so important for all of us to know our own stories. And I have to tell my clients this quite a bit. But, the universe and God did not intend for you to have to compare your story to anyone else's. So that was your story. That's, what you went through. And it's very good to be grateful for what you have, but it doesn't mean that you did not suffer or have loss. And, no, you very well went through things. All of us did. So yeah.
But I think that's a common misperception. And I see that especially with a lot of parents. They're like, my kid has everything. Like, I give them this, they have access to this. So why are they depressed? Why are they anxious? And I think that if the parents were able to sometimes do a little bit of that work, then they would better understand why a child who supposedly, quote unquote, has it all still is not mentally supported in where they need to be. And, it's been very interesting, because recently I've had a plethora of 13 and 14-year-old males who are depressed or very anxious, some hospitalized for suicidal attempts or thoughts. They're all abusing THC to self-medicate for this issue that they're having. But it's funny, as I sit down and talk to them, they're like, I don't really have a good reason to be depressed, but I am. And that's deep for me, because I'm like, you're thinking that you don't have a reason, but it's something that you feel, and you have to validate your feelings. And so, I tell people we have to have a conversations with children. We have to stop negating and saying, your back can't really hurt. You're young, you're flexible, or you don't have these, you're not an adult yet. You don't have these stressors. And the reality is that many of these kids do, because they have access to social media. They're hearing things that are happening, which many of us were protected from as
That's
children.
right.
We didn't
We
know about all
were.
the chaos of the world. And then they have access to so much misinformation,
Yeah.
which takes them down more rabbit holes and things like that. And so I think that this is the kind of work that would be very transformative in our mental health facilities, right?
Hmm.
Helping
Hmm.
not
Oh,
only the
absolutely.
children,
Yeah.
but their families.
Yeah. So that's so interesting that you say that. I guess my response would be I actually would not be surprised at teenagers having more depression. I wouldn't be surprised at all. But from my reference point, growing up as I'm a fully middle-aged woman now. I'm 47. It was a different world. It was a different world. It's a very stressful world now. And I didn't grow up with the messages of there's a constant threat on your life. Generations previous to us did. The baby
Yes,
boomers grew
yes.
up with the nuclear war fear, and the golden ages grew up during the depression. But I know from because I'm older than you, but I know from my age group, we had some halcyon days. So I could see where they would feel that way. But I think having some kind of practice, which the most basic is just any kind of mindfulness. So you don't have to take time away. I know your population are busy, you're in school and working parents.
Mhm.
So always having like a formal sit down meditation might be difficult, although even 5 minutes is better than nothing. But mindfulness, which is just taking a moment to take a breath, taking a moment to reflect, good for parents and good for kids, and certainly harmless. And sometimes when you start looking for those pockets of a moment to reflect, you might find out that you might have 3 minutes in the car before you take the kids to soccer practice. Or you might have actually a few minutes. You went to the grocery store, but you didn't maybe have to rush right into the grocery store. You could take
Mhm.
a few minutes and take 5 deep breaths, then go into the grocery store. But having something like that will help you tap into your own nervous system. And then that'll help you deal with little people's nervous systems that are depending on you.
That is so real, right? Because if you're on it, man, have that problem. And then I just have to stop and go, oh, center yourself
Yeah.
before you walk in that space. And I tell people all the time, like, I'm such a work in progress. Like, I never, I have a lot of knowledge, but actually applying the knowledge is super hard. And
Very
it takes
hard.
practice. It
Yeah.
takes such practice of saying, calm yourself, mind, figuring it out. When you're mindful in a moment, then you often can calm yourself down. When you're not,
Mm-hmm.
you're going to say things that you didn't mean to say, possibly do things that you didn't may not have meant to say, and then you create a conundrum, right?
Yeah.
And depending on your personality or who you are, some people internalize that. Some of us are more like the outlying things. And
Yeah.
so, but we all need to kind of take that time and learn and practice it, right? But
Yeah.
I would love to see. I told a friend the other day, I said, I need you to just say mindfulness. If you see me, just say mindful, so I can pull myself.
Yeah.
Okay, let me delve into this so that I'm making rational decisions. And that is, if we could teach our kids how to do that,
Yeah.
then they're not out committing some random crime because somebody offended them, right? They can go
Hmm.
back and say, they
Take
can
a breath.
you,
Yeah.
take a breath, move it. I really liked at the conference that we had recently where you showed us the Tai Chi body washing, right?
Oh, yay.
Yes. And I
Yes.
actually have
Yes.
patients do that
Oh,
now. So I've been
nice. That's what
teaching
I
them
do.
how to do that. And you guys
Mhm.
can just kind of Google, but it's a Tai Chi practice where you're helping to just kind of release and
Just even out your energy. Yeah.
releasing that energy.
Mhm.
And it's interesting because when they're able to do that, especially if they're
Mhm.
in their room and they're just becoming overwhelmed, I'm like,
Yeah.
just try it a few times.
Mhm.
And we try some different breathing techniques and things for even the little children. But I really would love for more people to accept, integrative medicine, these
Mhm.
other things that we may not have all the answers for, like why they make sense, but
Mhm.
realize that they've been practiced for centuries.
Yes. There's so much mystery to it, but things that we know from some of the major healing systems such as Ayurveda is 6,000 years old. It's pretty old. So there's some real knowledge there. So, of course, where did they get their knowledge from? Maybe that gets a little creepy. Let's not worry about that. But we do know or worry about it like when you watch your Ancient Alien show or something like that. But right now, don't worry about that. Ayurveda is 6,000 years old. We know that traditional Chinese medicine, I think, is like 4,000 years old. So what's hard for us as Westerners is that a lot of these practices are speaking in the whole. So they speak of emotion, the elements, the sun, the moon, the stars, and your physical symptoms. We in the West, we get uncomfortable with that, whereas we start with the physical symptom and then we try to work our way out, and we want everything to be sort of neat and in a package. And so that is uncomfortable. So it's easy for us to say, well, there's no proof. There's no proof, but actually there really is proof. It's just that we have to loosen up some of our Western, overly scientific, overly logical way of thinking and step into more of that feeling side. And maybe we don't have the terms for it, or maybe we do have the names for it, but yeah, there's definitely science behind it.
Right. And just as physicists have taken years to figure out many things, right?
Mm-hmm.
But we didn't stop and say, oh, well, we're not going to send these space shuttles into space because you haven't figured out every detail of why this works.
Oh, yeah.
Exactly. And so energy is so powerful, and we know that. And so I've been fortunate just to kind of learn more, and it's been so cool for me to just see how I can even teach children a little bit. And maybe if we all start thinking just outside and ground ourselves in our environments to
Mm-hmm.
see the beauty, to see how we are connected to this earth,
Mm-hmm.
because the earth keeps trying to connect us to her.
But we don't
We're like,
listen.
we're not listening.
We don't want to
And
listen.
we don't want to listen.
Yeah.
But there is a connection that is to be made. And that doesn't
Uh-huh.
go against religions. That doesn't go against anything, because if you do practice a religion, then you believe that someone created the earth, right? And if you don't practice a religion, you're believing some things came together to create the space. So there's still energy, there's still movement. And I think that we all need to connect into that further. So I appreciate you all listening. Thank you so much, Dr. Davis, for joining me. You all definitely check out her podcast webpage. Here, I'm about to say Healing Arts.
And can I make a little plug? Do you mind? Yeah, so it's Healing Arts, Health and Wellness, or if you Google at Dr. Charlyce, I do have an ebook I created that explains some of what we talked about. It is a little bit more for adults. Well, it applies to kids, but it's more for developed
This
adults
is
called
for adults. So
Chakras.
you all,
Oh, good, good. Okay, so
yes.
it's called Chakras and Hormones, and it's an ebook that walks you through the major glands in your body, the hormones those make, and how those line up with your chakras. So I just made that. It does pop up on my websites, but I'm actually really proud. And it's a good way to start experimenting and thinking about some of that kind of East-West healing.
Well, and I saw that you were putting that, and I need to download it myself, because I've just recently been learning about chakras and the hormones, and it's very interesting. It's very interesting. Very interesting. One more thing to delve into and learn, and that's why I said, as physicians, we have to be forever learners. I encourage everyone to be a forever learner, but we definitely have to, because our goal is to make sure that people are much healthier, and we're able to introduce different facets so that we can really help people to truly heal, instead of just putting band-aids on band-aids, because it doesn't, as you see in the adult world, it doesn't really get them anywhere, but we have opportunities. So you all, this is Dr. Jihan with Raising Resilient Minds, our wonderful guest. Please check out her podcast, website, download that book. I would love to have a discussion later on about it, because these are the things that we need to learn about if we really want to succeed as a society in a space that is so stressful. So tune in next time, and thank you so much for joining us.